Good afternoon, everyone. Welcome to Funder to Funder call. Thank you for taking some time out of your day to join us. This is Brad Ward. I'm the lead strategist for community philanthropy here at the Council on Foundation. We're going to jump right into some housekeeping items to keep this call moving. If you have any challenges at any point along the way, we are here for you with the ability to immediately respond via email. That is webinars@cof.org. There's also a chat feature within GoToWebinar. Feel free to use that at any time. If you are a telephone participant, please feel free to utilize a landline, which will give you the best audio clarity if you by chance have that capacity to do so. There's a help desk within the toolbar for GoToWebinar. And if you'd like to ask a question of the presenters, we're going to have a Q&A portion towards the end that we'll do our best to try to bring some of those questions to the surface. Any questions that do not get answered on today's call will get addressed after the fact. We'll work with our presenters to try to get the information that you may be looking for. You can enter those questions through the Q&A icon that is located on the sidebar of the GoToWebinar. This call is being recorded. We'll make this available shortly after the call, likely next week. You can find this on the page, on the event page where you registered. With that, I wanted to turn this over to my colleague, Stephanie Powers. Could not do this without her, and I certainly want to thank her for all the work that she's been doing on the background to support this in the middle of Foundations on the Hill, so she's been very busy. For those of you who don't know, Stephanie Powers is our Senior Advisor for Public Policy and Partnerships, and I'm going to turn it over to her.
Thank you, Brad, very much, and good afternoon, everyone. We've got a lot to cover in our call today, and I'd like to thank you all for your interest. And I'd like to extend a special thank you to our speakers for their willingness to join us on such short notice, as this call came together very quickly on Monday. But then again, such is the nature of pandemics, I would submit. I'd like to thank the council team that is in the room with me here as well, and I may need to turn to them for some technical advice throughout this, but I appreciate their work as well. The Council's goal at this point in this international crisis is to provide the platforms for Council members and other funders to share their grant-making responses and to gain insights from colleagues in our field who have expertise and best practices to share. This call is one of our tools to promote funder-to-funder learning and sharing. But the call today, I want to clarify, is not so much about what foundations are doing within their own operations, but rather in their role in helping communities respond to this public health emergency, and as national and global grant-making leaders with resources to help with the response. However, at the end of the discussion, I will tell you that there's a slide with information on the Council's Philanthropy Exchange digital communities, which provide an excellent forum for Council members to share operations responses and emergency best practices for their internal operations to keep operations intact and responsive to grantees and community needs. Let me quickly introduce our colleagues today who will be speaking. Not everybody who has joined us will be in front of a screen or on their computers, and some will just be listening in. I'll say a bit more about them and their specific focus as they came up to speak. But we are thankful today to have Leticia Babcock, who is with Medtronic Foundation, Purvi Bhatt with Medtronic Foundation, Irfan Hassan, who is at the New York Community Trust, Chris Herman at the Seattle Foundation, Julie Morita at the Robert Wood Johnson Foundation, Kevin Murphy at the Berks County Community Foundation in Pennsylvania, and Victoria Vrana from the Bill and Melinda Gates Foundation. These are all council members, and thank you for that, who are directly engaged in establishing community funds, doing grant making, and are actively responding to the coronavirus in their local communities as well as globally. So let's get started. On the agenda, can we just go back to the agenda slide? One more back. There we go. I just wanted to review that what we're going to do today is I'm just going to make a few comments about kind of the state of play of COVID-19 today from where we sit here in Washington. Several of our community foundations who are with us are going to be talking about what it's like to be on the front lines and their role as community foundations, and then local and globally health responsive grant making from our private foundation partners here and our corporate foundation, and then have some discussion about the role of foundations in working in the public sector, working with the public sector and public-private partnerships, and how some of that is being coordinated. We will have time at the end. We're trying to leave enough time for Q&A as well from those of you who are in the audience. So we can move ahead now. There we go, to COVID-19 today. So just a few comments about the landscape today. This week, this virus situation has been dubbed officially as a pandemic. While the cases in China seem to be decreasing, the transmission is spreading to other countries rapidly now. More tests are becoming available, so the numbers may start to spike as more are being formally diagnosed. As of this morning, on the Johns Hopkins dashboard worldwide, there are 127,750 diagnosed cases. 116 countries are involved, 4,717 deaths that are mostly in China, but 30 deaths here in the United States. As of this morning, 19 states and the District of Columbia have now declared a state of emergency. Several city and county health departments have done so as well. This week, the FEMA, Federal Emergency Management Agency here in the Department of Homeland Security, has activated its National Business Emergency Operations Center and is now having twice weekly conference calls to do updates on the cross-federal responses to help the nation's supply chains stay operational in this time of crisis. Think about food supply and groceries, fuel deliveries in the winter regions of the country, distribution centers for goods, etc. And just one reminder about the supply chains is that many of these workers are those who cannot telecommute and who are putting themselves out there at high risk to keep the supply chains open and running. The Council is monitoring these calls, these twice weekly calls, as well as the National FEMA dashboard that is available to track the coordination of the federal response. Essentially, the federal government is moving into an emergency response mode, such as when we deal with national disasters. This time the disaster is the coronavirus. Just to note, I heard on Tuesday's call that there's a concern about the limited supply of personal protective equipment, PPE, as it's being called by those who are in that arena, for mainly frontline healthcare workers. Much of the product is made in China, so we probably don't have to say too much more about why there is a shortage. And the federal government is now opening its critical stockpile equipment at governor's request. So I wanted to point that out because I thought there may be something in this shortage for foundations to consider supporting, and I would encourage you to check with your state and local health departments about that. As we speak, House Speaker Nancy Pelosi is deep in negotiations with Treasury Secretary Steve Mnuchin on a massive emergency aid package for Americans affected by the outbreak. House Resolution 6201 would shore up the safety net programs like food assistance, unemployment insurance, and temporary sick leave, with growing numbers of people forced to stay home from work and schools. It would also make free coronavirus testing widely available in a bid to address the nation's struggle in containing this outbreak. And with the stock market cratering, lawmakers are increasingly nervous about leaving Washington on Thursday because they are supposed to be going out on a break without passing some kind of relief package. And we just did see on the alerts that the Federal Reserve has now put $1.5 trillion into short-term lending markets to try to shore those up. I would also tell you that in relation to the legislation that is being negotiated, an urgent letter has been transmitted to members of Congress imploring them not to forget about the nonprofit community as they are looking for relief, given that the nonprofit community provides so many critical services to those in need. Before we dive into our speakers and their responses, I just wanted to reference that the Council has a resource hub for the virus, for coronavirus, COVID-19, for funder information designed specifically for a funder audience and resources. As everyone is saying, check the CDC, Center for Disease Control, for updates, and for those of you in the global space, the World Health Organization. And also, I would highly recommend that you consult the excellent webpage that the Center for Disaster Philanthropy has. It's really chock full of resources and great information, and we appreciate their partnership in these emergency situations. So now we're going to dive into philanthropy's response. We're going to start with our community foundations, and I wanted to ask Chris Hermans to unmute the line. Chris is the Chief Impact Officer at the Seattle Foundation, and Chris leads their existing philanthropic and programmatic initiatives. Chris has worked as a nonprofit executive and strategist, grant maker, fundraiser for 25 years, always advocating for equity and opportunity and strategic philanthropy. And she's going to be speaking about the need for the immediate response, Seattle Foundation being certainly at the epicenter of this epidemic, and what it's like to be working with both the private sector there as well as government. So Chris, I'm going to turn it over to you now.
Thank you, Stephanie, and thank you for inviting Seattle Foundation to be a part of this conversation. I think that I will try to give you what we know now, and we are in a situation where we used to say it used to change day to day, and now it changes hour by hour and minute by minute with the latest news that the president may restrict travel to Washington State. So about 10 days ago, Seattle Foundation, like many of you, no doubt, just kept track and saw the ways that we were learning more and more about the coronavirus outbreak here, the devastating impact, and the ways that it was continuing to unfold in creating uncertainty in the local community. And as we started thinking about our community partners and our partnerships with the public and private sectors, we started in conversation with the King County Executive Office, and were thinking about how would we prepare to deploy rapid resources, flexible resources quickly to community-based organizations that were going to be on the front lines of addressing the impacts of the coronavirus outbreak. And so within a few days, a number of our funding partners who we sit next to in other collaboratives and pooled funds started in conversation. And last Friday and Saturday, we decided to come together in an unprecedented way, create a unified, coordinated approach, and stand up the COVID-19 Response Fund here in the greater King County, Puget Sound area. And it was meant to show a unified collective approach to a crisis that we knew little about, but started to get a sense of the devastation it could have in the near term as well as the long term. So what we also want to do is make sure that as Public Health, County, and City of Seattle started their ramping up the public health response and the healthcare delivery system response, we commended our colleagues at the Gates Foundation that was investing in that infrastructure and system, and noted that it was probably critical that we think about how to develop a complementary community-based response system. And so we launched the fund formally on Monday morning. Today we have close to, I think, about 15 to 20 partners We are at $9.2 million, and this includes a partnership with Connie and Steve Ballmer, with Alaska Airlines and Amazon, Microsoft, Starbucks, JP Morgan Chase, Costco, BECU, Amazon, City and the County, United Way, came together very quickly, and we are now focused on trying to move resources where they're needed most. Should say the focus of this fund is going to be general operating grants to community-based organizations that are the front lines, that have deep roots in the community and strong experience being able to deliver supports and services in crisis. And specifically, this phase of the fund is geared towards the economic and health impacts on the residents and families who are most vulnerable. And so for us, that's focused on residents without health insurance, without paid sick leave, people with limited English proficiency who have faced barriers to access to both care as well as safety and protection information, healthcare and gig economy workers, and then communities of color generally, where we know that existing disparities are felt the greatest, and we knew that this crisis would likely have just magnified those disparities. So right now, the first phase grants will leverage the existing trusting relationships that community-based organizations have. It'll be focused on the economic impact of reduced and lost work. We've seen that already. Every day we see closures and announcements of restaurant chains closing. So we know that from the business, especially small business sector, that they're experiencing anywhere from 40 to 90% decline in income as well as business. And so there's the ripple effect of those closures, especially on individuals and families whose income is generated through multiple part-time jobs, contract work, gig economy work. We also know that in culturally specific medical and community health centers, there is a higher demand for medical information and support. So getting information out that is in multiple languages and people who are from community is incredibly important. And then finally, we know that given the origins of the virus and the spread, that there is a good bit of discrimination and bias being projected against vulnerable communities, especially communities of color and ethnic communities. So we're also very mindful of moving resources there. So we are anticipating that this will be grants on a rolling basis, and that we will continue to assess in real time where the need is most. Right now, we are preparing to work with the King County's Pandemic Community Advisory Group, which was stood up before we launched the fund, and we decided to work with the county to expand the charter of that to serve as advisors to this fund. It's 40 individuals that represent the wide and diverse geographic as well as demographic communities across the region, and represent providers who have these trusted relationships. They will, going forward, meet weekly, and they are meeting right now as we are talking, and they're reviewing the criteria and beginning to develop a process for how we're going to move the dollars out. So Seattle Foundation will administer the grants as the host. We are working closely with United Way and of King County and our other partners that helped inform the criteria and the grants process. We are not, however, having a formal application process. Our goal is to use the existing trusting relationships that all of us have across the region and to move dollars where they're needed most, specifically that are aligned with the criteria around supporting communities that are most vulnerable to the economic and health impacts in the short term. We understand that keeping this as a rolling grant program is important because we actually don't know the full extent of the devastation or the impact this is going to have. We know it has incredible ripple effects already as nonprofits have canceled their annual galas and events that are scheduled in March and April, which provide essential revenue for keeping their doors open and their services offered. And so we recognize that there are things we just don't know. But right now we know that a number of people who are one paycheck away from becoming homeless are in immediate danger of that likelihood. And so we're moving dollars, and our goal is to try to move dollars in the next few weeks. So for us, I think we have learned that it's really important to be agile and flexible and move quickly, especially when you actually don't know what tomorrow's going to bring, much less what's going to happen the next day or the next morning. That all of this really came together in real time because we had existing deep partnerships with King County and the City of Seattle, with our partners with United Way of King County, as well as all of the individual and private and public partners. And because we sit next to them at tables and other funder collaboratives, it was easy to trust one another and put aside any kind of institutional self-interest for the good of the community. And it was really important that we figured out how to move the resources with the existing networks and capacities we had, knowing the dollars needed to go into the community in direct services and supporting vulnerable individuals and families. And so for us, the Seattle Foundation was positioned to be able to take this all on and to do so. All of the donations, all the contributions go directly into the community. We are absorbing the in-kind impact of this for the foundation and hosting it and administering it. And we are just maximizing the learnings and the work that we have done for the last 75 years in partnership with corporations and foundations, in partnership with community-based leaders, to ensure that the communities disproportionately impacted and who are economically vulnerable are supported, so that the persistent health and economic disparities don't widen during this crisis. So I'm going to stop there, knowing there are going to probably be plenty of questions at the end of the day. I've also heard from some of you already, and happy to take those later. So thank you.
Thank you, Chris, very much. And we will have time for Q&A later. The ones that are in the queue, we'll take those up at the end, and Brad will moderate and do some Q&A with the presenters. So we're going to move on now to Kevin Murphy, who is the president and CEO of the Berks County Community Foundation in Pennsylvania. And the Community Foundation, Kevin and his team there have been focused on their own business continuity planning in the event that they're not able to operate in their building. You know, like many rural areas across the country, they are a first-line responder in many communities where the Community Foundation is one of the anchor institutions. So Kevin is also positioning the foundation to serve as a convener along with their emergency management agency, as well as being there to assist with the nonprofits and their grantees who are providing critical services. I think an interesting fact is we have to remind ourselves, for those of us from urban centers, like most Pennsylvania counties, their county doesn't have a health department. So Kevin, I'm going to turn this over to you to talk about what you're doing as a frontline responder.
Thanks, Stephanie. And of course, this is actually a really fast-breaking thing. While we've been on the phone, our governor took extraordinary actions and has basically ordered the county next to us to close down. All their schools are to be closed, their stores are to be closed, entertainment venues are going to be closed, and has also asked the rest of us who can stay home to stay at home, and that is the triggering event that we were waiting for to shut down our building. So that will happen, I believe, tomorrow. We began on March 8th, which was the weekend, to recognize that there was probably a big issue coming down the pike. And as Stephanie said, the first thing we did was review our business continuity plan and make sure we were prepared to work, have everybody work remotely and keep the operation running. We finished that on Tuesday because we had some software upgrades that we had to do at people's homes, but we're we're now prepared for this. We in Berks County have not had a reported case yet, but we're surrounded by counties that have had reported cases, including Montgomery County, where the vast majority of Pennsylvania's cases are. We've noted, and will be making an issue long term, that the counties that are reporting the cases generally are counties that have a county health department. There are only 6 Pennsylvania counties out of 67 that have that. I don't think we've concluded that county health departments caused the coronavirus. So we may have our first real strong evidence that they are better prepared than counties without a health department. We have a Health and Human Services Program Officer, Monica Reyes. In January, just as a matter of dumb luck, we established a relationship with the County Emergency Management Agency, primarily around our concern about how we would respond to a mass killing event in the county. And you may have seen coverage of that in the Chronicle of Philanthropy. In February, Monica started an organization called it's called a COVAD, Community Organizations Volunteering to Assist in Disasters. So she's been bringing together the Salvation Armies and Red Crosses, some of the churches, the food banks, the organizations that we would look to respond with our emergency management people in a disaster. That was just dumb luck and good timing. And she convened that group on Monday to coordinate the response here. We're constantly in contact with our social service partners and also our schools, colleges and universities, because as they're shutting down, it has ripple effects. And while we were on the phone, one of our school districts announced it will close Friday and Monday, so we'll be expecting more. We're also, I call it slow rolling. We've put basically a freeze on discretionary grants at the moment. We believe we're identifying at our program team level organizations that are going to likely take a revenue hit, things like child care agencies. One of our nature organizations does a lot of its revenue is school field trips, and that looks like that's likely to be disrupted. And then also identifying the organizations that are going to take an expense hit here with, if, as I suspect, the school districts close for a week or two, we're going to have huge pressures on some things like food bank, maybe some of the youth programming. I don't know what we're going to do with these kids yet. So, we're fortunate. We've not yet had a case that triggers a lot, and we're still very much in planning and coordinating with folks, and probably now moving into a different mode with the governor's request that if we can shut down, that we shut down.
Great, thank you, Kevin, very much. Now we're going to move on to hear from Irfan Hassan from the New York Community Trust, where he is the Program Director of Health and Behavioral Health, where he oversees the grant-making portfolio around health and behavioral health. New York Community Trust recognizes that COVID-19 will strain and test national and local public health system infrastructures and will obviously compound the economic challenges in communities, especially those that are already under-resourced. And certainly the New York Community Trust, having been at ground zero in 2001, understands the critical nature and importance of public-private partnerships and how to conduct those, knowing that no one entity can provide these solutions to their citizens alone. So Irfan, I'm going to turn it over to you now.
Great, thank you, Stephanie. So New York is the second most impacted state after Washington State. We have about 200 cases at this point. A majority of them are concentrated in the county of Westchester, which is just north of New York City, although there certainly are several in New York City. as well. The governor has declared a state of emergency, and I think the gravity of the challenge sort of evident that the St. Patrick's Day parade has been cancelled. It's the first time in 258 years. And I know it seems a little light to say it, but it does really speak to New York doesn't do those sort of cancellations very lightly, and they've canceled that next week. This disaster is different than some of the other disasters that we have all lived through. And I want to lay out a couple of ways in which it is different. First, the event itself is far more open-ended than other disasters, and therefore the responses required are also a little more open-ended. And Chris from the Seattle Foundation really brought that home in describing how they are looking at their grant making. It is also ever-changing, given that, in just the past 24 hours, it's been declared a pandemic. Kevin mentioned their governor's actions. So sort of by the time we're done with this call, there will probably be other changes around the country with regards to response. Second, like other disasters, certain people are at more risk than others. In this case, older adults and people who may be immunocompromised or with other chronic diseases. But unlike other disasters, since the transmission modes are relatively easy, everyone is at some risk. And as such, whether we like it or not, we will see increases in number of cases before we sort of flatline there and start to come down. And that is different than anything else we've seen. And third, historically, philanthropy has been outside of those impacted directly or potentially impacted, unless people who work at philanthropies were literally in the eye of a storm or lost a loved one during a crisis. But with COVID-19, philanthropy as a sector and those of us who work in it are also impacted like everyone else. We are, like the people across the nation, worried about being infected. And it is daunting to kind of to put into action business continuity plans, think about being quarantined, et cetera, not just theoretically, but actually in our own day-to-day lives. Stephanie mentioned that coordination between government and philanthropy is critical, and I think that remains very much so in this case. And while it's too early to have an established one-size-fits-all response for foundations, I wanted to share just a few points that foundations may want to think of both individually as an organization and collectively as a sector to figure out where to help and how to help. First, I think we can very easily institute some low-hanging fruit changes with our grantees, such as easing up submission processes and reporting deadlines, etc. They, like us, are in this and trying to figure out what to do. Second, even if there's no new money allocated as yet by our boards, we should do a very quick check-in with grantees to get accurate information as to the immediate needs and the projected medium and long-term needs. And I would say community foundations in particular are very well poised to do that. Chris mentioned earlier that the fact that they've got this fund up and running in Seattle and know very shortly who they're going to be able to grant out to indicates the fact that community foundations are really on the ground and know what's happening and know what needs to happen. Foundations can determine if any of the current projects or organizations that they're supporting can kind of pivot to respond to COVID-19 related activities with their funds and making sure that that obviously happens in a legal enough manner. Foundations should start to go through the hard task of prioritizing the needs that fit within kind of the regular grant making portfolios and see what might be able to be changed and targeted towards COVID-19. And while we recognize that not every foundation will be able to answer every need, we each can find a place for us to play a role in this response because it will be long and deep and involved. We should continue to capitalize on formal and informal philanthropy networks to share and coordinate, and I thank the Council for pulling this together, and I know regional grant maker associations around the country are doing similar conversations. I was on one with the New York folks earlier this morning, and that's really important because the last thing an emergency like this needs is confusion from funders by duplicating or omitting key response efforts. Another point that foundations do need to remember is that while COVID-19 will challenge us all, it's not like our regular business is going away. The areas of interest and the issues and challenges that we use our funding for still remain. And completely switching will just create another set of challenges. So we really need to do a fine balancing act of how do we respond, but how do we not forget what we also do regularly on a day-to-day basis. And finally, we need to remember that we are ineffective as grant makers if we don't take care of ourselves, our staff, and our foundations. We need to put into place the efforts that we can to be able to do remote work, etc., pretty quickly, but we also need to make sure that we do check-ins on our own colleagues as well, because we will be on the front lines as well. For those who are interested in sort of where an immediate response might be helpful, certainly Chris shared some of the ideas that she was looking at up in Seattle. I think more generally, foundations, at least at this stage, trying to ensure, and this is some of the stuff that the New York Community Trust is looking to do, is ensure that those who are at high risk have some of their basic needs covered. While government will be putting in, hopefully, more money around testing and transmission, et cetera, most state labs are still vastly under-resourced, even with some of the government money, and the quick turnaround money that philanthropy can offer, I think, is really, really helpful on that front. And then finally, I just wanted to take a couple of minutes before I end, just to sort of talk about how as community foundations, we can responsibly communicate with a community in a way that it doesn't create more panic. And I'd say there are four sort of big buckets that we should keep in mind as we think about that aspect of our work. First, we need to make sure that we keep our own houses in order and have a plan, etc. Second, we need to be upfront with grantees that there really is no playbook for this type of situation. We're all learning as we go along with COVID-19. And I think being flexible, creative, and thoughtful will really be the watchwords as we roll out whatever philanthropic responses we'll be involved in. WHO, CDC, state and local health departments appear to be communicating with the same messages. We should adopt those as much as possible. We don't want to create confusion with multiple messages. And finally, we shouldn't try to get too far ahead to think about what the needs will be in a week or 2 weeks or 3 weeks, because this thing is so changing. We need to kind of think of it generally, but we shouldn't try to plan out too much far in the future, because we are going to be called on this response for a very, very long time. Thank you.
Thank you very much. And I don't know, I can't remember if I mentioned this at the beginning, but I appreciate your comments, Irfan, about how we as the staff of foundations and certainly with all of our fellow citizens are all affected. We're all kind of, washing our hands and using to the grant-making responses in the public health arena, both locally and globally. And I'd like to ask Purvi and Leticia to talk about the lessons that they have learned, certainly in a company that has deep global experience. Medtronic, as probably most of you know, is a medical device company, and lots of lessons that you have to share with us about the Africa Ebola response and perhaps other types of pandemics that the company has dealt with, both I think from a resource point of view that includes not only money and product, but also employee engagement and volunteer engagement. So Purvi, I'm going to turn it over to you, and I know you and Leticia are going to share your time.
Well, thank you. And first of all, thanks for the opportunity to be together and working this through. It is a fluid situation. I really appreciated Irfan's point that we're all managing through this in our own lives just as much as we're supporting others. And I'm literally speaking to you from home as I'm taking care of an elderly mom. And so I just really want to make sure we continue to support each other as we're going through this. So for Medtronic Foundation, just to cast a wide net and introduce who we are, we, like many of our colleagues who are in the corporate foundation, corporate philanthropy space, have a range of assets that we can bring in solving the world's biggest problems as a healthcare company. We have a unique role and responsibility in times of crisis like this to really bring thought capital as well as the deployment of resources to ensure the best possible outcomes for communities in need. As a foundation, our main aim is to improve access to healthcare for the underserved and then support communities where we live and give around the world. And basically, in the end, that just means in layman terms, really making sure we're inspiring, supporting partners, and delivering thought capital that makes a meaningful impact for people who want to change their lives for the better. And that includes our employees. For us, again, because we're a healthcare company, we certainly have objectives that are around health and global health and really focusing on empowering health workers and ensuring that underserved patients really do achieve better health over a window of time. Where civic engagement comes into play, this is really the bread and butter of corporate philanthropic work. So many of our colleagues who also work in corporate philanthropy really know this space extremely well alongside us. And that involves engaging our employees. For us, that means really doubling down on volunteerism and helping ensure that they are equipped to give as best they wish in communities where they live and give. And then us investing in communities directly based on whatever the communities where we have a great footprint, whatever the issues are that are most impactful for them. When we look across all of these components, it's clear in times of disaster and emergency, all three are activated for us. And again, when it's a unique situation where a health issue is the disaster, that puts us in a unique place where we actually do need to be incredibly thoughtful about who we partner with, how we partner, and how we show up. Bring the right kind of calm together with urgency to package a response. And also, as employees ourselves inside of the communities where we're working, make sure that we're really responsive to what our own families are needing, what we as leaders are trying to do for our own teams, and also ensuring that we're really listening to what's happening in the community around us and bringing that back in so that our company is able to respond as best possible. We learned a lot in the Ebola response. So if we could move to the next slide. And it was a very interesting time for us because not only was Ebola certainly a global crisis as well, and it activated everything that we knew in global health. And then many of us who came out of global health came out of a HIV response, a tuberculosis response, are very well versed in infectious diseases, myself included. And so it seemed very reasonable to think through what could we do in West Africa. What's unique is that in the Twin Cities, which is Medtronic's operational headquarters, we happen to have the world's largest Liberian community outside of Liberia. So it enforced us to quickly think about what do we need to do from a community perspective, an employee perspective, and a global health response when the Ebola outbreak happened. And we learned a few things and we're continuing to learn. But what was essential is that we wanted to pull forward what we already know are the key ingredients of a global health response. Follow what WHO and CDC are signaling in terms of severity. We did the same thing in this response to COVID-19. Well before it was called COVID-19, really paying attention to what was being told to us by WHO, and knew very quickly that as soon as it signaled pandemic, we're going to need to position for a broader response, which Leticia will start to get into as we transition to her. We also knew that we had to find a way to be locally relevant in highly impacted areas while also positioning for global spread because it's an infectious disease and we knew it would spread. And that happened, of course, across West Africa, but we saw it even then in a domestic response in terms of travelers and people who, frankly, like expatriates who were here in the Twin Cities wanted to go back and provide assistance. And it pushed us to think about creative partnerships that we wouldn't have naturally thought of, as being a part of this response. During the Ebola response, we partnered with UNICEF, we partnered with and extended and redirected our existing partnership with groups like Last Mile Health and a variety of other players that were deeply embedded in West Africa, but help them reposition for being a part of this type of disaster response. But we also partnered with community organizations in the Twin Cities who were really responsive to the concerns of the Liberian community here. We wouldn't have seen that if we didn't think about this in a broader way. And that came to really coming up with the right mix of organizations, really knowing, back to the responsibility of being a healthcare company, really knowing that we needed to make sure we had a good mix of credibility in terms of who we were partnering with, their ear to the ground on what was needing, our flexibility to meet them where they were, while also, again, making sure we were bringing calm and reason to what was happening within our company. The company itself was also responding during West Africa, absolutely responding now, given who we are. When you think about the flow of products and services that Medtronic offers, we go deep inside of tertiary care facilities, not only for elective care, but absolutely during times of emergent need, whether it be sudden cardiac arrest or stroke. All of that is still happening right now. So the call to really redirect services to make sure we're keeping those hospitals clear, making sure ICUs and the rest are staying clear is really essential. And so back to why we focus on community health workers is to make sure we're handling as much as possible upstream and enabling that part of the workforce, the healthcare workforce, to be effective. But our company is strained when we have to move in these directions. And then finally, we know, as Irfan also echoed earlier, that we're in this for the long haul because this is something that's going to take some time. What was helpful for us during the Ebola outbreak is really being sharp and clear about who are our long-term partners already and what is it that we can do together, and just adjusting a bit to what's going on today, and then creatively thinking through what could a long-term partnership look like. As a part of our overall disaster response, we've been thinking through this for Puerto Rico and what's been happening there, and in California during the wildfires. And typically when we go in for a longer response, again, it'll be in the space of healthcare and what we can do next there. But this was no one has a playbook for these things, but we started to see some very similar pillars that we could pull from as we were responding to COVID, noting that we have operations in China and had to respond globally first, as we're all breathlessly trying to sort through what do we need to do domestically now, because with each hour comes a new set of directives on what we can do. So with that, I'm going to move this over to Leticia, who leads our work day to day in responding to the multitudes of disaster relief responses that we have to coordinate.
Thanks, Corby. So using those learnings that you spoke to and realizing the urgent and dynamic nature of this pandemic and how it's requiring us to be nimble and adapt in real time, this is what our response looks like so far. And note that we kind of titled this Phase 1. As Corby had mentioned, we started our response in China as a global company, but now as we speak, with more than half our employee base in the U.S., we're reassessing what the needs are of employees of the company, our partners and communities, and really thinking through how we can support in targeted ways. And so initially, we utilized our existing disaster response framework, but realizing quickly on that this health crisis required a health response. So we honed in on 3 areas: employees, and partners, and NGOs. So our compassionate employees spoke up right away, wanted to know how they could help, and so we established a volunteer and giving on our volunteer and giving web platform. We established a page where employees can make donations to a handful of organizations we identified, make a $10 minimum donation, and we'll match it dollar for dollar. We also realized as well that we need to pivot some of our volunteerism. Lots of hands-on opportunities that we ourselves, the foundation, have organized, and others in local communities, and starting to take a look at that and offering some opportunities that are virtual and can leverage the skills of our employees. With our partners, we engaged our local philanthropy liaisons, so our employees that are passionate and stepped up as leaders in philanthropy locally, looking to them for information on what the needs are and how we can support, and also working very closely with our business and regional colleagues and others within the Medtronic company to align on our needs. Also partnered with our existing disaster relief partners, as well as explored other opportunities to best assess and respond to the needs, as well as discussing what we can do to prepare other locations, as well as those that have already been impacted, looking at the long term and seeing what we can do there. I'd also be remiss if I didn't mention what Medtronic PLC, the company, has been doing as well, as we've been sort of in lockstep with our response. There have been product donations made from the company related to severe respiratory illnesses and responding to that need. Also, we have a corporate crisis team and a community work stream that's been working really close on the business and employee impacts and our response efforts, as well as the health and safety of our employees. So we do have a employee emergency assistance fund established in which employees can tap into if needed in response to impacts they may have felt in relation to this outbreak. And lastly, I'll also mention that among all this, we've also looked at impact measures. So we are proud of our sort of rigor around the impact when we award our grantees, and this too is something that we look to make sure that there's impact that can be made and that our resources can be leveraged and be of most value in this situation.
Great, thank you very much, Corby and Leticia. All right, so we're going to move on now and hear from Julie Morita from the Robert Wood Johnson Foundation. Obviously, there's a deep, rich history with the Robert Wood Johnson Foundation, with their history of working in public health. And Julie is the Executive Vice President there at the Foundation. So, Julie, I'm going to turn this over to you now to talk about your insights, perspectives from the Foundation staff and experts.
Thanks so much, Stephanie, for inviting me to participate in this panel. It's funny, the invitation that I received to participate in the panel came because I was one of the first people to sign up for this webinar. And I'm really glad that I signed up because I've learned a lot and heard so much interesting information and valuable information from the panelists who spoke previously. It's so clear that this public-private partnerships are critical to the success of these kinds of responses. So thank you so much for hosting this and for inviting me to participate. I'm going to run through this fairly quickly just because I have to jump off the call. But just in order of how to, as Stephanie mentioned, the Robert Wood Johnson Foundation has a long and rich history of working in public health areas. And because of that, we've been intimately involved with and heavily involved with preparedness in the past, emergency preparedness as it relates to public health issues. What we have chosen to do really as we move forward with this COVID-19 response is focus in on informing and advocating for preparedness approaches that ensure equitable public response to COVID-19. As many of you know, the Robert Wood Johnson Foundation is really focused on building a culture of health and addressing health equity, where everyone in the U.S. has an opportunity to live has a fair and just opportunity to live a healthy life. And this concept of equity is often forgotten as in emergency response situations. And so we're lifting this up as a critical element and really focusing on those who are most likely to be adversely impacted by the outbreak, but then also by the response activities that are implemented. Sometimes what we do is inadvertently affect those who are most vulnerable, and we really need to be aware of that. The second area of focus for us has really been to maintain our usual grant making, but then also to strategically support crisis response grant making as well. So in addition to maintaining our work, because we recognize that if we continue to keep our grants flowing and moving, we're able to continue to support the organizations that need the funding right now. That's really essential, but also looking at ways that we can also more strategically address the crisis that's occurring right now. And then the last area that we were focusing on, and although this is really not a webinar about addressing internal operational needs, because the foundation is a resident, is a citizen in our offices where we're located in New Jersey and New York City and DC, what we do with our staff and how we handle our staff and support our staffs through these types of crises is it really does impact the communities themselves. And so we have paid special attention to ensuring the health and well-being of our staff, because we recognize that that makes such a big difference within the communities in which we work and also where we live. In terms of public health support and the grant making that we actually do, we have over the years supported development of public health readiness ratings that really rank jurisdictions at the federal level as well as at the state and local level to say how ready are they to respond to emergencies like this, because we recognize that there's public health funding is really limited and insufficient. And so what this has done is helped us to really support gap filling and also to justify increased public health funding. As it is right now, public health only makes up 2.5% of health spending in the nation. So we are grossly underfunded. Public health is grossly underfunded. The other thing as we've done in the past, as others have mentioned, is really respond to specific crises or disasters, so hurricanes. We do respond and provide funding in those situations as well. But one of the things that we've learned over the many years of dealing with public health emergencies is that in order that CDC Foundation actually has an ability to mobilize, respond to, and provide for needs that are unmet by slow federal funds that are coming through, or just knowing what's happening on the ground in terms of the needs. And so we have for years maintained a reserve fund of about $5 million, and we replenish that as it gets used. And so what we did at the end of January is we mobilized $1 million to support immediate laboratory needs within the local jurisdictions that were affected. And so we moved that out really quickly through the foundation. Then just this week, the CDC Foundation asked us for an additional support. And so we were releasing an additional $1 million to support food, childcare, and housing for those people who are quarantined and in need of these kinds of social services. So we'll be mobilizing those funds. The CDC Foundation has really been a great partner of ours over the years because they can swiftly respond and they have an ear to the ground in terms of what the needs are as it relates to these public health emergencies. And what they're doing right now is they've created a crowdsourcing fund. It's called All of Us Combat Coronavirus. And so if you go to their website, you can actually find out about this crowdsourcing fund. And you can then contribute to that fund itself and know that those funds are being used well and for important things. And so I think that's one way that we've been able to respond nimbly and address needs that are identified through CDC and through CDC and the foundation. The last thing that we've done recently has really been to provide some funding to the Association of State and Territorial Health Officers who provide message maps to the state health officers. So when you're looking on the news and in the media, you're seeing a lot of the health officers on the spot having to respond and communicate effectively so that we can get people to prepare and to respond appropriately, but not to panic. And so this ASTO, Association of State and Territorial Officers, we supported some message mapping development for them to get the messages out to the state health officers. And then we are also looking at our grant making and looking at our current grantees and getting a sense of what their needs are, and also getting ideas to do more strategic planning to make sure our grant making really meets their needs. In terms of the advocating for preparedness approaches to be equitable, what we were really pleased with is that Rich, our CEO, penned an op-ed that was published in the Washington Post on March 6th. What it did is it really highlighted that certain demographics will be disproportionately impacted due to their economic, social, or health status. And so the elderly, the disabled, people living in rural or native communities, people living in close quarters, public housing, nursing homes, jails, shelters, or even the homeless. And also workers who are non-salaried or who have precarious work schedules, really lifting up these groups so that they're not forgotten as we think about these crisis responses. And so we're really thrilled to see all the legislation that's moving right now or trying to be moved to actually address the needs of these folks, because we recognize this is the first time that I can recall in a public health crisis where there's actually been this kind of attention to those that are most vulnerable, and we're really thrilled to see that. The other thing that Rich has been able to do is he was invited to participate on the National Academy of Medicine Standing Committee on Emerging Infectious Diseases in the 21st century. And so, and again, he participated just yesterday to lifts up this need for us not to forget the most vulnerable, so that as policies are being implemented to respond to this outbreak, that actually we're not forgetting it or adversely impacting those who are most vulnerable or who are the greatest need. So I think those are some of the key things that we've actually been doing. And then the other thing I think, just from an external programmatic perspective, that we've really been focusing on is really making sure that we're communicating regularly with our grantees. We have access to reliable and trusted information through public health sources. And so making sure that they know what those sources are and they have that information at their fingertips. There's so much noise out there and so much misinformation. Using information, really helping share reliable sources to our grantees has been really, really important. And then also sharing with them our changes in policy so that they're well aware that we're focusing on making sure that they get their funding, that they're not negatively impacted if they have to cancel travel or their meetings have to be canceled. We don't want them to be suffering as well. I guess I'll stop there, and I apologize because I can't stay on to answer any questions, but I do have to jump off the call. But I do appreciate having this opportunity to share with you our experiences and what the direction that we're heading. Thanks so much.
Thank you very much, Julie. We knew that you would have to jump off, so thanks for all of that. I'm going to wind up this part of our discussion with Victoria Vrana, who is the Deputy Director of Philanthropic Partnerships at the Bill and Melinda Gates Foundation, who is going to bring us some insights around our responsibility as funders to support grantees, which I think there's an interesting insight here that we may not have thought of, and that is the kind of financial impact on grantees if they have to cancel events, particularly those that contribute to their annual budgets, and that some may not be making those decisions because of the cost factor and the loss of dollars. Victoria, I'm turning this over to you now to enlighten us a little bit more on that point.
Sure. Thanks so much, Stephanie. And I'll go through this quickly so we have time for questions, but I'm so grateful to the council and the others who've spoken. I know I have learned so much already in the last 67 minutes, and I'm sure many of you have too. I'm going to talk about three things: quick overview of the global philanthropics response to date, what the Gates Foundation is doing and what our approach is, and then, as Stephanie mentioned, I would really like to talk about grantees a little bit. So really quickly on the philanthropic response, this is all from Candid, and it's all from yesterday, so it's probably out of date already, but Candid's been closely tracking the global private philanthropic response to COVID. And so far, it's dwarfed funding, obviously, from natural disasters in the past. It's reached $1.3 billion as of yesterday, and companies are leading the way. Lots of this is because of China. It is a significant response from around the world, but it's not enough. And so I'm so thrilled to see the pace and the acceleration of collaborative funding, and just really grateful and hopeful to see more and more in the days to come. On the next slide, you can see that Candid so far, they're tracking 180 grants. Again, a lot coming out of China so far. The US is next. You can kind of see this breakdown. All of this information is on Candid's site. Really interesting to note that much of this is pledged and doesn't have specific recipients yet. And this is a place where foundations and community foundations can play such an important role, because you know the organizations, you vetted the organizations. And so to the extent that funds and collaborations can be set up that attracts this funding and gives it an outlet, incredibly important role for foundations. Next slide. I think it just talks about, yeah, this just shows you in the amazing Candid kind of data visualization, the lack of designated recipients if you follow through it. And we'll go to the next slide. And so far too, I'll just mention before I pause on the philanthropic funding piece, we don't know yet what the everyday giving response will be like, but I anticipate that's going to be record breaking. And we're in touch with GoFundMe and PayPal and Facebook and Global Giving, all of whom, you know, Global Giving in particular has set up a fund. If you look at GoFundMe right now, there's 1,700 kind of campaigns, many of them in Italian. So everyday people want to express that generosity just like philanthropists. And it's going to be key to have virtual volunteering opportunities and outlets for people's generosity and willingness to help. I think it helps us all feel better in these situations when we can do something. So the Gates response, which makes me feel better when I'm feeling worried, it's evolving rapidly, as you can imagine. At this time, our COVID-19 mission consists of 3 components. First of all, to rapidly accelerate the detection and the containment of the virus. Second, to protect the most vulnerable in the way that we were just hearing about from Robert Wood Johnson. For us, that means at-risk populations in Africa and South Asia. And our third priority is to develop vaccines, therapeutics, and diagnostics for a sustained response. The foundation has committed $105 million for COVID-19 efforts to date. 60 million of that is focused on R&D for drugs, vaccines, and diagnostics for low-income countries. We announced an $125 million therapeutic accelerator this week, which brings together the Bill and Melinda Gates Foundation, the Wellcome Trust, and MasterCard to support getting the most promising therapeutics through clinical trials and the manufacture process as quickly as possible. Co-funding will be key to all of these models. Despite the resources we have, they will not be enough. And so we are, again, encouraged about the interest we see in co-funding from all different kinds of places and levels of giving. Many of you may have read about the home diagnostic kits for Seattle, and the foundation is currently working with government agencies to determine if and how this could be rolled out nationally. 40 million of our funds so far are focused on surveillance, modeling, and health system support in Africa and South Asia. As we were just hearing from the Robert Wood Johnson Foundation, the most vulnerable are at huge risk here. We're very concerned that cases of coronavirus in these areas will overwhelm health facilities. And that while deaths from coronavirus could be high, deaths from non-related issues could be even higher if they're not treated. Last Gates response for now is the Gates Philanthropy Partners, which is the foundation's public charity. There's a website for it. You can go check it out if you haven't seen it. It's establishing a COVID-19 fund that will co-fund all of these priorities alongside the foundation. That should be launching shortly. So our response may evolve over time, but our general approach will likely stay consistent. And so now I do want to say a little bit about grantees. You've heard others mention this, but we are hearing from both our individual grantees, our sector infrastructures, and our fellow funders strong concerns and worries about grantees. Nonprofits are incredibly concerned about losing revenue from events, and it's keeping folks from canceling events that they should. I think that's going to change in the next week or two, but the worries are still real. And they seem to be exacerbated in some cases by funders and sponsors who aren't letting organizations transfer sponsorship to virtual efforts. There are other organizations are wrestling with limitations on grant agreements. And I'll give you a great example that Tim Delaney at the National Council of Nonprofits shared with me late last night. He was talking about a nonprofit that's taken a big role in census turnout. And they have a bunch of grants, and the grants have specific metrics, right? We all love specific metrics in our grants, and they're supposed to have people attending census prep events in person, but they're in a hot zone state, and they're trying to protect public health by shifting to virtual training, which is something, you know, they may or may not know how to do, frankly, and they're being told by funders that they can't. They got to follow the grant agreement. And so there are ways that, you know, if we just stop and immediately look at our grants, look at our agreements, look at how we're supporting the organizations in our portfolio, there's so much that we can do. Nonprofits need maximum flexibility right now and support. And the sector infrastructure will also need support because they're the hubs of knowledge exchange, just like the council is for nonprofits. Another easy thing to do right now is just reach out to your grantees if you haven't. An email is great. It will go a long way. A call is even better. We're finding an incredible opportunity to really connect with our partners this week. And I intend to keep in close touch as time goes along. The economic picture will only make the anxiety and the realities worse for nonprofits. So we have to keep that in mind. Think about what you have the power to do in your role and at your institution.
Thank you very much, Victoria. The last item that we did have on our planned agenda was around a little bit of a discussion around public-private partnerships, but I think we've heard quite a bit from most everybody about their efforts to coordinate and connect with particularly state and local government in the responses. So I'm not going to spend a lot of time on that. I would like to, I think, make one sort of observation, one comment, and that is, I think the universal guidance here on working with the public sector is to coordinate with your local emergency management agencies and your state and local health departments and leaders and all of that. I think that's just kind of the ongoing advice. One thing I would say too, I'm going to turn this over to Brad to do some of the Q&A, but we also have on our website, on our resource hub, a survey that we are collecting stories and advice and the tips that you all have. So please do feel free to go in and fill that out, and we will keep this information evergreen and fresh on our resource hub website. I guess as we are heading to our homes for the next couple of weeks, we'll have plenty of time to work on the web pages, won't we? So I want to thank all of our speakers. They've all been just terrific. And I'm going to turn this over to Brad now for Q&A. And then, Brad, when we're done, just a couple of minutes to close things up with the last couple of slides.
Right now about questions and answers, and you can continue to submit those, and we'll do our best to consolidate after the fact. There's a lot of resources that will answer some of the questions that have been coming through. So those can be found on the Coronavirus Resource Hub, and you can see the web link there. I want to go ahead and really quickly have Manuela switch to the next screen. Another great place for those of you who are members of the council to keep this conversation going and being able to share. So the survey will feed our capacity to give some templates and best practices, policies and procedures that are starting to emerge. The Philanthropy Exchange is another really solid place where dialogues are already happening around how to respond to this, at least in a communications forum. But there's an open exchange where all funders can communicate with one another and share templates and so forth. That's on the Philanthropy Exchange, and you can see the website there. For questions for the speakers, while we've got them with us, I'd like to turn to Irfan first, if you're ready for me. While you were talking, a question came in that correlated nicely with what you were speaking about, and it was really about the notion of multiple inquiries from multiple funders could compound the workloads of grantees. So the question is, how can funders coordinate checking with their grantees? And wanted to see what your thoughts were on that.
Sure, thank you. Thanks, Brad. I'd say there are two strategies that you could deploy on that. One is sort of the grantees that you know are likely to be part of the response. And there is a difference between grantees who may be on the front lines in responding to stuff versus grantees who are obviously affected by it, which is a much larger category. For the group that is on the front lines, I think just maybe even a mass email to folks saying, what are you doing? Let me know. And that would give you the information you need on that front. To get a read on what is happening broadly with the sector beyond sort of the immediate response end of things, just like we focus on sort of the public-private partnerships with government, I think membership organizations for different sectors are great resources to get that read, because they, I am sure, are in contact with their members who in turn are sharing what the challenges are. And that will give you, rather than grantee by grantee, which can be both time consuming and perhaps just not even practical, give you the information that you need. Thanks.
Thank you. Thank you. I'll ask any of the other speakers, Purvi, Victoria, any thoughts from your perspective on how that might be playing out in your community?
I think this is Porby, just in echoing, without going into great depth on what Irfan just said, it is really important, building, I think, on what Victoria said too, is to be proactive, right? And being open to making sure that we're asking what's needed above and beyond what might have been requested, and being clear. And again, with trusted partners that most of us have, we're in that day-to-day discussion anyway across our team. But being very, very intentional about that, I think, is important. It's kind of down to the first principles of just coming back to basics on how you're building that relationship and staying in that relationship, even though it's complicated by our own response and trying to manage, working from home or taking care of each other, but staying really right in it with them.
And it's Victoria. I would just add that, understanding that all of our partners are many of them will have to pivot their work. I mean, just like all of us are. I don't know about your week, but my week just changed a lot from what I planned to do. And it's the same thing with organizations. So they may be canceling an event, but they're not going to stop fundraising. They may be changing their programming, but they're not going to stop doing it. And again, they may not have the tools, skills, know-how, and extra resources to pivot. And so how do we acknowledge, understand that they may be changing how they're getting to their goal, but they still have the same goal? And so how do we help them get there and get them what they need? And having that conversation and making sure they're not afraid to have that conversation with us.
Thank you. Porvi, while I have you, you had just commented right before Victoria. I was curious if there's any lessons that you just want to quickly highlight. You did, reference some of this within your presentation, but any specific lessons that you think are specifically helpful for other corporate foundations? As we heard in the Seattle Foundation example, a lot of the support that they're getting with their relief fund is coming through coordinated response with the corporations in their community. So I just wanted to see if you had anything else that you'd like to add from the corporate funder perspective.
Sure. One of the things I've learned over the years is that just remembering all of our organizations, but certainly corporations, have so many hats that they wear and they represent that sometimes we don't realize. And in times like this, a quick phone call to a long-term partner that we may have might actually move a rock for one of our nonprofit partners or another community foundation or anyone else. And so I think those are some of the big things that are more thinking laterally than thinking vertically, and figuring out what's the best opportunity in playing this forward. And then coming together across, not just, what I love about this call is the diversity of different groups involved in philanthropy coming together. I've learned a ton because it's rare that we have that. But there's also an opportunity across within an industry to come together and find complementarity, and then across industries as well right now. And so I would just put those things on the table. And that's easier to see when we have the outcome and the result clear in sight. And at a time like this, like with many emergencies, it's fast and easy to think about we need more dollars, and we do, but we actually probably need more voice and more clarity on the outcome that we'll actually get to with those dollars. And so, business principles tend to be really helpful in times like this. So those are the three big things that I would carry. And those are, again, my colleagues who work in this space would have a wealth of information to add to mine.
Thank you, Porvi. I really appreciate that. Chris, I wanted to turn to you at Seattle Foundation, just given the nature of how well you've been coordinating with corporations. Any advice, any suggestions of how best to connect with corporations? Because clearly those in the community were looking to you to be some type of a depository and a coordinator of funding. So what's your thoughts on what was working incredibly well, and what other advice might you have on coordinating the corporate funding opportunities more broadly?
Thank you, Brad. I think I would reiterate what I mentioned in my remarks, and that's the piece. We were able to move this quickly because we had existing relationships with a core group of corporations, foundations, and other philanthropic institutions. So it meant we could start with a diverse group that had experience with one another in funder collaboratives or pooled funds, trying to move dollars where they can have great impact in the region. And so we were able to start with that group. And then, as you all know, this is all about stitching networks together. And as the information and we were able to publicize the launch of the fund, that generated a kind of response from corporations and foundations that we had the kind of the next tier, secondary and tertiary relationships with. And so we have then subsequently have just been doing additional outreach to ensure that everyone understands that this is one of many ways that corporations and foundations that can step in and coordinate together. And we have that vehicle if it's the right one for their company, for their strategy. So in reinforcing much of what's been here, the corporations are like, we'd like a singular coordinated vehicle for this kind of contribution, and we will do in-kind. We will be doing volunteer work. In-kind, that's to furniture, food, to quarantine sites, things like that, as well as staff who want to support and volunteer, although because we've had social distancing requirements in place, that's difficult. But it really is about, when you get to the emergency, which you all know, that when you're in that moment, it's almost too late. So it was helpful that we had these relationships in place we could look to and call upon quickly.
Thank you. And you certainly have done that. And I know that for some community foundations, establishing a fund may not be necessary. There might be a strong enough network that the dollars can flow to the right place. But where there needed to be centralization, you all certainly answered that call. So thank you. I've got one more question, and then I'm going to turn it back over to Stephanie. And I'd like to address it to Irfan. Thinking during your talk, this kind of maybe just from a public health perspective, where would you recommend people go for the best, most accurate information that might help them be best informed about how this is playing out in their community? Any advice from you about where people could go for most accurate information on this pandemic?
Well, I would say health department, certainly. I mean, the level, the frequency that they put it out on may not be as frequent as we would all like, but ultimately that is where the data is. I would suggest that if you are a nonprofit and a health center, then certainly through, again, your membership associations that have connections with health departments and so on. But that, I think, is really the source, because that is the data. That is where responses are going to be developed. So I'd suggest health departments. I'd love my other panelists to share if there are other ideas that they think would be good sources too.
Anyone else on that? I appreciate that. I think public health means you're talking to your local sources. It means you're in constant communication about how you can mobilize the philanthropic response. I'm going to turn it over to Stephanie. I know that we're running out of time and you want to wrap this up.
I do. Okay, Brad, maybe just as one more thought about your last point, and that is the local cable stations for your local government as well, county governments and your city cable stations. Much information about the local responses are being communicated to residents and citizens through that. So I'd like to thank everyone for joining us today, and especially to our speakers. Thank you very, very much. We have an incredible amount of intellectual capital and, of course, passion and commitment in our field. Just as a couple of observations to wind us down, I would say communicate with your congressional offices about the commitment needed to equitable response for all communities as they are contemplating these pieces of legislation. I'm not suggesting that private foundations should be lobbying for that health bill or that bill, but educating and communicating with your members of Congress so that they can understand what the impacts are if things don't happen or certain things do happen. give them the language of equity. The one thing that I've learned is that many of those offices on Capitol Hill do not understand what we really mean, by equitable access to health care, and the language is helpful for them so that they know how to talk about it themselves when they get onto the floor, and that their staffs do. Tell them the stories, give them stories, and also communicate what resources that you have and that you can bring to the table in their districts. That's always something that they're interested in. And I want to just maybe end with a little bit about social distancing. So I have a personal stake in this besides my own health, but I have a 91-year-old mother who's in a nursing home in New Hampshire, and it's been weighing very heavily on my mind, especially this last week. And I did talk to her this morning, and she sounded actually very shaky, and she was very worried. She didn't quite understand what all this was, and she just thought that the world was going crazy. And I had to tell her that I was canceling my trip to see her next week because I didn't want to come from Washington, D.C. to see her, and the possibility of me carrying the virus without knowing it. So don't forget, everybody, call your elderly relatives and neighbors because they are going to feel socially isolated. And of course, as we're seeing 24 hours a day, wash those hands 20 seconds and sing happy birthday, right? So thank you all very much for being with us. And we will let you know when we're on to our next one, because I think we probably will have a continuing conversation over this next couple of months. Thank you, and everyone stay in good health.